really depends on the size of the organization and the resources that are available, right? So, um, like for the 5 years that I had employee health reporting to me, there were some. I mean, it was a heavy workload for sure. So I guess whether you want to wear multiple hats, it depends on how strong your neck is and how how willing you are to have a lot of the you get pulled in multiple different directions, and so it really depends. I think. What type of employee health experience it is. If it's doing workers' comp and the traditional kind of hospital-based employee health, then that maybe is quite a lot unless you have the appropriate resources to support that. There's a lot of overlap between employee health and infection prevention, so some of that fits very neatly together. Um, so for the period of time that I had employee health reporting to me, it was okay. The workers' comp was challenging because that was not my forte and that was not something that I was particularly interested in. But the employee health components it was manageable and it was interesting. And so, I certainly learned a lot. When I transitioned out of that role in that facility and into a larger system facility, it was separated, which certainly made sense, right? Because I had so many more beds that I was responsible for the infection prevention program. I had ambulatory clinics. There was a lot. It grew quite a bit. And so without enough resources, that would not have been a very reasonable coupling. But I'm glad that I had the background in employee health. Um, I worked very closely with the employee health leaders in the organization. Over the course of the 11 years that I was there, we changed a couple of different directors. Um, but I understood where they were coming from and kind of the language that they speak and the priorities that they have. And there is a lot of overlap between infection prevention and employee health. So it's a really good partnership. And so I think it benefited me having that experience in employee health, and perhaps made me a better partner to my employee health partners.